Welcome to Section 5 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program, inspired course for non-specialists. In the previous section, we focused on developing personalized treatment plans, understanding the individual's experience, setting goals, and choosing the right interventions. Now, we move into practical support strategies that help individuals and families understand and manage depression. We begin with an essential component of mental health care: psychoeducation for patients and families. Why is psychoeducation important? Psychoeducation means providing information about depression, its symptoms, treatment options, and how it can be managed. It's one of the most effective tools we have for helping people with depression and their loved ones feel more empowered and informed. When someone is diagnosed with depression, it can be overwhelming, not just for the individual, but also for their family and community. Psychoeducation helps reduce confusion, eliminate stigma, and offer hope. It teaches the person with depression and their family that depression is treatable and they are not alone in their journey. What does psychoeducation involve? Psychoeducation is about sharing clear, simple information on key aspects of depression. Here's how you can break it down. 1. Understanding depression. Help the person and their family understand that depression is not a weakness or personal failing. It is a medical condition like diabetes or hypertension, and it involves changes in brain chemistry and mood regulation. You might say something like, "Depression is not your fault. It's a condition that affects how you feel, think, and act. But just like any illness, with the right treatment, you can get better." 2. Symptoms of depression. Explain the common symptoms of depression so everyone involved can recognize them and avoid misinterpretation. For example, feeling sad, losing interest in things, sleeping too much or too little, and feeling tired or hopeless. You can say, "Depression doesn't always look like sadness. Sometimes it's more about feeling tired all the time or losing interest in things you used to enjoy." 3. Treatment options. Discuss the different treatment options available so the person with depression knows what their choices are and the family understands how they can be supportive. These options include therapy, talk therapies, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, can help change negative thought patterns and behaviors. Medication. Antidepressants like SSRIs are common, but they take time to work and often need monitoring. Lifestyle changes, regular exercise, a balanced diet, and proper sleep hygiene can help improve mood. Social support. Encouraging connections with family, friends, or support groups can provide comfort. You might say, treatment may involve talking to a counselor or doctor, taking medication, or making small changes to your lifestyle. Each person's treatment plan is different, but the important thing is that you have options. 4. The role of family and friends. Involve the family by teaching them how they can support their loved one. Family members can help by being patient, understanding, and non-judgmental. You might explain, "Your support is crucial. You don't need to have all the answers. Just being there to listen and encouraging treatment can make a big difference." Let's pause for reflection. How do you think families and friends can help a person with depression feel less isolated or ashamed? What small steps could you take in your own community to start conversations about depression so it feels less intimidating for people to seek help? Psychoeducation is a powerful tool, but the way it's delivered makes all the difference. A real-world example. Amina is a mother of 3 in Kano, struggling with depression after the death of her husband. Her sister, Fatima, notices that Amina has become withdrawn and irritable. Instead of telling her to snap out of it, Fatima sits down with Amina and gently explains what depression is and how it's affecting her. Fatima also shares that there are ways to treat depression through therapy, support, and possibly medication. She offers to go with Amina to the health center, and together they begin the journey toward recovery. By providing psychoeducation, Fatima helped Amina understand that what she was going through wasn't a sign of personal weakness. It was a medical condition that could be treated. In summary, psychoeducation helps individuals and families understand depression, reduce stigma, and feel more empowered in managing the condition. It involves providing clear, simple information about depression, treatment options, and how to support loved ones. Family support is key, both in providing emotional care and helping to guide the individual toward recovery. In our next lesson, we'll explore lifestyle and behavioral modifications, how changes in daily habits and routines can support the treatment of depression and improve overall well-being. But before we move on, here's your reflection. What can you do in your daily life to support someone with depression, whether through small actions, better understanding, or encouragement of healthy routines? Let's continue building compassion and practical support.